It's the year 2030, and there's much for Americans to celebrate as they look back. Over the previous 15 years, public health had evolved to become a foundation of strength and support for the broad-based reinvention of the country's economy and society. Technologies and approaches like the next generation of social networking and the healthy communities movement had improved health starting in the late 20th century. State and local public health agencies, or PHAs, had played a major role in stimulating more intelligent and collaborative health generation in their communities. Over time, local health improvement initiatives fused into a broad national public health infrastructure through which communities could exchange their ideas and innovations. These movements accelerated community transformations while advancing health and equity. Given widespread concerns about the quality of the information being propagated on the Internet and social media, the public increasingly looked to experts in PHAs to help them distinguish good information from bad and knowledge from opinion when it came to improving health and safety in communities. The healthcare reforms of the early 2010s expanded health insurance roles and incentivized healthcare systems to improve population health. Research and evaluations drew upon databases of genomic and socioeconomic data, as well as biomonitoring devices worn by many people. PHAs and healthcare providers used these analytics to direct their funding priorities for population health strategies. By 2020, these networks for improving health and health care had evolved into a community health learning system in which public health leaders used sophisticated simulations of neighborhoods and communities to model potential interventions for impact and cost effectiveness. PHAs cut their clinical health services as their role in community strategy grew and access to effective health care became nearly universal. PHAs also advanced health equity by ensuring that new innovations were more quickly made available and affordable to low-income groups. Meanwhile, extreme weather events took their toll on the country. PHAs played a greater role in emergency preparedness, in part by facilitating pre-event resilience games to teach community groups about the roles they could play in disaster response. PHAs also worked to reduce their environmental footprints and shifted from a traditional role of environmental health to a new role of environmental responsibility and sustainability. As cognitive computing, automation, and 3D printing reduced the need for human labor and knowledge workers, declining tax revenues forced governments to cut programs and services. Income supports like the Earned Income Tax Credit expanded but were still insufficient. Many Americans adapted by creating new livelihoods built from diverse activities that each provided some of their family's needs for food, goods, and other services. These included time banks, where people exchanged their labor hour for hour with their neighbors, and collaborative consumption schemes where people shared cars and bikes. Community gardening and home food production boomed. These mechanisms allowed people a high standard of living on little or no formal employment income. Many communities also initiated truth and reconciliation processes to discuss discrimination that had existed in the past. They had realized that it was foolish to expect oppressed groups to participate fully in 21st century society if their 19th and 20th century wounds were left untended. National and community foundations funded efforts to hold the space for oppressed groups to speak their truths. The process offered a deep catharsis as all Americans came to see themselves in the experiences that were being shared. At the same time, increased awareness of economic injustice led to greater tax fairness, a national living wage, and other social and economic reforms. By 2030, the result was a stronger, healthier, and more equitable American community, held together by a vast network of optimistic and proactive leaders. PHAs had played a central role in supporting many of these developments and were able to look back on 2 decades of surprising success.